use an ambu bag for?
You can use an ambu bag, or if they have the little Trach collar, you can go up on the oxygen. Or if they don't, then you would use an ambu bag and pre-oxygenate them, usually about 2 to 3 minutes. So same with our suction. We still have our PPE on because we placed it earlier. So we have our face shield. I assessed the lung sounds already, so they sound fine. I'm not going to do it again. So with the clean gloves, I'm going to go ahead and remove this dirty, soiled dressing. And get rid of it. Toss it. And I'm going to take off my gloves, hand sanitize, and open up my kit. And you do need saline here. Always open away from you. I like to put it here. That way that little flap is not going everywhere. I'm going to put my sterile gloves on. Actually, just one. I'm going to grab this, and I can actually use both because I have that 1 inch. Just make sure this one you're keeping sterile, because now you're done with something sterile. Put that over the chest. I'm going to put all my supplies here. And I'm going to pour saline into my containers. 1, 2, oops, actually 3. I shouldn't be crossing over my gloves, by the way. Okay. Now I'm ready. Now I can put my second glove on. If you grab these green ones, because I actually have a sensitivity to latex, it's kind of hard, it's very sticky. Okay, so now I can start distributing some of my supplies here. Make sure I have everything I need. And I'm going to put these guys in here, because this is what I'm going to use to clean. I'm going to put them in my big one. I already have my gloves. Okay, I'm going to leave this stuff here. Okay. So the very first thing I'm going to do is, now this one's going to be like considered dirty. I'm going to pull this out. And I'm going to let it soak here in the first one. Let that stay there. Let it soak for a few minutes. And then you're going to put it in here and scrub. It's kind of hard to be 100% sterile, because you can see, like, although I want to keep this is the main thing. You want to keep it sterile because you're going to put that back in. You're going to put it here, scrub it again. And this is still considered like my sterile one. This is my clean dirty. I'm going to tap my excess. Get one of these dry. Put it back in. Okay, that's back in. That was your part that you really want to make sure you try to stay as sterile as possible. It's kind of hard, as you can tell. And I'm going to go ahead and with this, clean around the trach area. Clean. I get my little brushes. Clean a little bit. Not too hard. Now I'm going to put my gas sponge. And I'm going to put my new trach ties. Don't undo both at the same time. These both should have been attached, but only one was. You only want to do one at a time, because in case the patient coughs, you don't want this to become dislodged. And not until you're on this side you can remove this old one. I'm going to make your little tie here. Okay, make sure that you have at least 2 fingers that you can put to ensure it's not too tight. And then get rid of your mess. Discard all of your soiled material. Perform hand hygiene and document time, patient tolerance, and if there was any kind of abnormalities that you saw. If this is all we did, then we would auscultate before, pre-oxygenate to 20%, and but because we did both, we were okay with our breath sounds, and we already pre-oxygenated. If you notice that your patient's in a little distress, it would be okay for you to pre-oxygenate for 20%, although you just suction and you just kind of, it's to your assessment, whatever you see. Yes?
So you were saying, like, if the patient were to cough and it dislodges, so what happens if it does dislodge?
You should have an obturator in your room, and you would stick the obturator in there.
Which prevents it from collapsing.
It prevents it, yes, from calling, and you keep an airway open. That was a good question, because that has happened. Any other questions?
I have 2 questions actually. When it came to the suctioning, you know how you were going like this with your wrist? Is it okay if we just do this? Because that's what I was taught to do. It actually, they
What do you mean,
told
like
me,
just like this?
like when you
Roll
roll
your
it
finger?
in between
Oh,
your
yeah,
fingers.
yeah, you can do that too.
And then my other one was, I don't know if it's, because I haven't worked in a hospital setting with the trach, but I had a trach patient for home health care. And whenever it came for us to changing out the trach, instead of taking the trach out and cleaning it, we always used his other one. So that way this one, no, we still kept that one. But we
Okay.
just cleaned that one at another time.
Yes.
And then we reused that one once it was clean.
You can totally do that if you have that option. But we teach you, like, there's only one, so you know how to provide the care.
The only reason we did that was because it prevented us from having him off of that too long, because as soon as it went back in, like we had it ready already, like that little setup right there on the bed. So as soon as we took this one out, we put that one back in and then connected him, because he was on 24-hour event.
And quite honestly, most of your trachs in the hospital with the inner cannulas are disposable. So really, we don't, but we have to teach you this. What about if you go to a third world country or you work with those people? They don't have a lot of supplies, so you have to clean the things and reuse a lot of stuff. So we teach you how to do everything in any environment. Yeah, but there is a lot of people who do have a secondary one, so you put that one in to have it ready to go, which that would be ideal. But we need to teach you how to clean this as well. Any other questions?
So what if, let's say you're in the middle of cleaning, doing the trach care, and they suddenly can't, or have labored breathing, or they need to stop. Do we just stop where we're at and give them oxygen? Or
Yeah,
just
yeah, you're not gonna do, wait, la 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 la.
So then you would
So-
take off all your sterile
Oh
gloves,
yeah, and
everything,
you'd
then-
put them on a trach mask or something. Yeah, because airway would take priority at that point.
And then, see, let's say you take that off, but you didn't anticipate you have to stop. Do you go out of the room, go get some more sterile gloves, and then
After?
continue?
Oh yeah, after. But you want to stabilize your patient first. That's priority.
And that's why I asked that question, if we could have that other one, like that other backup one, because it kind of prevents that from happening.
Yeah. And that's probably most of your cases that you're going to encounter. Yes.
This is actually not related to this, but last week, did you show us the IV line? 'Cause I don't
No. Next week we're gonna